Now this is very interesting MRI. Now this is MRI of the whole spine. We can see the whole spine here. Now the interesting things are that if you see closely, we can see this L1. Now this is a bone. We can see this is a vertebra, and this vertebra we can come to know that both upper border, lower border, the posterior border and anterior border, they are very well defined. It means this bone is intact. So these are perfectly rectangular shaped, and all the borders like upper, lower, posterior and anterior, they are intact. That is the reason why this vertebra is significantly well preserved. But see here, now we see it is labeled as L1, that is the lumbar first vertebra, and the margins of this lumbar vertebra, they are extensively abnormal. The lower margin is preserved, the posterior is preserved up to half, but the anterior is totally destroyed, and superior we are not able to trace. There is loss of this typical bony feature of this bone here. It means that this vertebra is completely collapsed. So this is a collapsed vertebra, and we can see that hyperdensity. Now this hyperdensity typically shows edema. This hyperdensity or increased whiteness typically shows edema, which is not here, which is not here, which is not here. So this, if edema is there, it shows that this vertebra has been compressed or fractured very recently. That is the reason why there is increased blood flow and there is this edema, which is very well obvious in this picture. On the same hand, this T12 vertebra is also fractured, though lower margin is patent. The posterior margin is slightly abnormal. The anterior is only abnormal. Only around two-thirds is present, but one-third is damaged, and upper border is not able to see. So there is also fracture of this T12 vertebra, but this marrow abnormality is not here. It means that this is an old fracture. This is old fracture because of absence of this marrow marrow changes. Other things that we need to understand is the disc bulges. Now we must know that in between the two vertebra, what we have is a disc, intervertebral disc. So these intervertebral discs are usually placed in this area also, this area only. But many of the time, this disc simply bulges to the posterior side. It simply bulges to the posterior side. Now, how to come to know? Now, what we can see is here, this is the spinal cord that is very well apparent here, and this is the subarachnoid space. This is the subarachnoid space. Now, this subarachnoid space is very, very well patent because you can see both anterior as well as posterior margins. Compare the same thing here. In this area, basically this subarachnoid space is compressed. That is the reason why there is a curvature. There is concavity. You can see there is concavity here. There is concavity here. So why this concavity is there? Because this disc is simply compressing to the posterior side. And we must know that all the roots like lumbar root, dorsal root, sacral roots, they actually emerge from this area. This is the spinal cord. So simply they emerge from this area. So that is the reason why these exits of these roots are compressed, and that causes then sensory or motor changes of this particular segment which is involved. One more thing I would like to highlight is we have a typical curvature. So this is the cervical curvature, this is thoracic curvature. We were supposed to have a lumbar curvature this way. It should have an anterior convexity towards the anterior side and concavity toward the posterior side. But in this case, it is totally more of a flat. You can see there is more of a straightening of this lumbar area, which is also very abnormal. And this is very much common cause of pain. And this is usually because of the spasm associated with the paraspinal muscles spasm because of the bony abnormality, muscles abnormality, or excessive of workload. So thank you, and we'll be meeting in other video as well.